just got home from day 12. I've never, not once, cried during a nursing shift, but this was the first time that I've cried. And it was because I was just so overwhelmed with all of the things that I needed to do. And it just kind of snowballed and then snowballed. And it just felt like I was so far under the snow that I was kind of drowning. I don't hide my emotions on my face. Like, it's hard for me to hide it. You will see what I'm feeling. And so the charge nurse took one look at me and she asked me if I was okay. I opened up to her. I was like, no, I'm feeling very overwhelmed. And so she told me to go take a breather, step outside. She went up to my preceptor and kind of told him to just kind of take over for now until like I recuperate, got some fresh air. And that was the first time that I just cried and I just felt very like incompetent. But basically what happened was I started off the shift with one patient. She came in for DKA and septic shock. So she was getting, hourly blood sugar checks. We were titrating her levo. She was maxed out on levo and she was on baso. And her blood pressure was like soft in the 60s over 30s. We were just trying to get everything stabilized. And then I was told that I was going to get an admission and that I was going to receive report in the room. The ER nurse is giving me a report. For the first time, I haven't even looked into the chart. And basically this patient arrived in the ED, had a cardiac arrest in the ED. She was placed on a ventilator and then brought to our unit. And as soon as she got onto our unit, she started having seizures. Doctors were putting in a bunch of orders. We had rounds at 10 and I only knew what the ER nurse told me. Like, I didn't have time to go into the chart. So when the doctor was asking me questions about this patient and if I needed anything, I felt very like dumb because I literally don't know this patient. I didn't even look at the labs. I didn't have time to look at the labs. If you know, now because she's an admission, not only am I doing what the new orders that the doctors are putting in for the seizures, but I have to do like my admission and assessment and other homegirl over there. Like, I'm falling behind on her blood sugar checks and I haven't even charted for her yet. So everything was just snowballing and I got very overwhelmed. Thank God I have the next 2 days off to just kind of reset. So yeah, I'm just gonna go to bed.